Hello, we talk about diagnostic imaging to oral and maxillofacial surgery, and I alaa. Start with introduction. Oral and maxillofacial radiology are also known as dental and maxillofacial radiology. Is that a specialty of dentistry concerned with performance and interpretation of diagnostic imaging, used for examining the craniofacial, dental, and adjacent structure. Classification of radiograph technique. عندنا specialty radiograph وconventional radiograph. Specialized radiograph هي CT, CBCT, MRI والultrasound imaging. Conventional radiograph intraoral radiograph والextraoral radiograph. الانتراoral radiograph اللي هي periapical radiograph, bitewing radiograph occlusal radiograph. أما الextraoral radiograph هي OBG, cephalometric and TMJ radiograph. Intraoral periapical radiographs. The film shows the internal crown and root of teeth and its surrounding structure. It's essential to obtain the full length of tooth and at least 2 mm of periapical bone. هنا واضح عندنا الفيلم طالع عندنا full length crown and surrounded periapical bone. Indication of intraoral radiographs. Another periapical radiograph for distinguish between complicated crown fracture and uncomplicated crown fracture. See in this image clinically نشوف البulb exposure and the radiograph fracture continuous to the pulp and that is called complicated crown fracture. But in this image the fracture see simple and clinically هنا أما الراديوغراف البulb doesn't affect the fracture, so that's called uncomplicated crown fracture. Periapical radiograph for pre-extraction planning for development anomalies. هنا نسي the first image عندنا dilaceration. أما هنا periapical radiograph for ankylosis. وهنا عندنا for root morphology عندنا in the second premolar عندنا 3 root. هنا periapical radiograph for a foreign body after extraction. هنا عندنا root after extraction. هنا periapical radiograph for impacting third molar. حتى نعرف relation between factor effects to the third molar surgery involve external oblique ridge and anterior posterior relation the ramus, vertical depth of the impacted and number and morphology of roots. أما the second image هنا periapical abscess حتى نعرف extent and site of the abscess. dentina alveolar fracture. In this case clinically كانت الكلينيكال مالتها mobile tooth tender to palpation and percussion و non response to cold test. الراديوغراف اللي أخذناها see the horizontal line in the cervical third root of tooth نشوفها in this image. البايتوينج radiographs. هنا عندنا حتى نعرف ال high of the alveolar bone and how about the bone loss. Indication occlusal radiograph for foreign body in the jaw and stone in duct of salivary gland. See in this image calcified stone in worn duct. هنا نشوف supernumerary teeth in this image. For occlusal radiograph for fracture maxillary or mandibular. هنا in this image نشوف suture after mandibular fracture associated with failed implant. أما in the second image نشوف patient response. This patient يعني limited open mouth يكون. perfect choice for radiograph نستخدم occlusal radiographs. To determine the middle and lateral pathology and to detect the disease of the palate or floor of the mouth, see in this image نشوف nasopalatal cyst واضحة. هذا extraoral radiograph. عندنا panoramic imaging. orthopantomogram also known orthopantomograph وpantomogram or OBG is a single tomographic image of facial structure that include both the maxillary and mandibular dental arch and their structures. Indication of OBG for general dental health evaluation for caries and bulb origin disease. See in this image هنا عندنا dental caries. أما هنا for trauma assessment for tooth or jaw fracture. In this image نشوف mandibular fracture هذا. OBG for infection evaluation sinusitis. Sinusitis for maxillary sinus effect على الماxillary bone destruction and displacement of teeth. هاي sinusitis مؤشرة. OBG for radicular cyst evaluation. هنا عندنا radicular cyst. ال OBG هنا for anterior dislocation of هنا الcondyle. هاي هنا ما عندنا الفراكشر مجرد الديسلوكيشن. هنا ال OBG for foreign body شفناها عن طريق ال OBG. هنا سيالوثايسس اللي هي بمعنى salivary gland stone. هنا واضحة بهذه الإيمج. ال OBG for growth and development monitor for pediatric teeth حتى نشوف ال location, shape, supernumerary to prevent or prepare for a future aesthetic issue. هنا OBG for initial and prognosis orthodontic treatment واضحة بهذه الإيمج الأورثودونتيك. ال cephalometric radiography it's used with cephalocyte that helps maintain the constant relationship among the skull, film and X-ray beam. Main indication in orthodontic surgery: a pre-operative evaluation of skeletal and soft tissue patterns to assist in treatment planning, post-operative appraisal of results of surgery and long-term follow-up studies. Indication of cephalometric radiography: عندنا lateral cephalometric projection. هنا indication for middle third facial fracture. الصورة A before fracture, B fracture in maxillary bone. هنا نشوف بالlateral cephalometric projection الساينس. عندنا frontal sinus, maxillary sinus والsphenoidal sinus. هنا هذول واضحات الساينس. هنا indication lateral cephalometric for any condition that affect the skull like in this image اللي هو البيجت disease. هو الكرونيك ديزيز تكون process abnormal تسوي excess break down and regrowth of bone حتى البون هنا يكون bigger and softer than normal. هنا عندنا lateral cephalometric for سلة توركا واضحة بهذه الإيمج. indication posterior anterior skull projection. هنا clinically نشوف right new nature skull brace هذه. أما الراديوغرافي نشوف right brace skull fracture. هنا نشوف frontal sinus expansion واضحة brace circle. هنا عندنا for palmar calcification for valve cerebri. هنا عندنا الكالسيفيكيشن. هنا همينة بايجيت disease. السبمنتو vertex projection base of skull نشوفها الفيو هو البيس of skull حتى for fracture or displacement for zygomatic arch. هنا عندنا الفراكتشر of zygomatic arch. أما هنا الwater projection indication for evaluation facial fracture for zygomatic arch. هنا zygomatic arch fracture. وهنا for orbital rim and floor fracture. هذه orbital rim fracture. الأوباسيفيكيشن هنا نشوفها brace circle ونقارنها بالماكسيلاري ساينس in another side نشوفها تختلف. وهنا من اكو ساينونايزال inflammation disease والساينس ostial obstruction هذول الاثنين تكون very common and cause opacification. air fluid level suggest to the acute sinusitis. أما chronic sinusitis تكون through the mucosal thickness and sclerosis of bone. الأوبليك lateral projection of the mandibular body and ramus. هنا نشوف for assess to the unerupted tooth. هنا نشوفها unerupted teeth موجودة عندنا بهذه الإيمج. أما second indication for a fracture. هنا عندنا mandibular fracture. TMJ radiography. Plate films usually consist of combination of transcranial, transpharyngeal, and transorbital and submentrovertex basal projection. Allow visualization of TMJ in various planes. هنا عندنا transcranial view نشوف من خلاله ال movement of TMJ بين ال open and closed. هنا عندنا closed أول وحدة closed TMJ بعدين هنا صار بيها open بعدين رجع closed. Transorbital view نشوف هنا ال anterior view of TMJ if a fracture of condyle, neck of condyle or any displacement of condyle. هنا transorbital view مال condyle. أما ال transpharyngeal view نشوف lateral view of condyle and head and neck and any cyst, tumor or dislocation or fracture of condyle. The indication of TMJ radiograph to assess degree of movement of joint. هنا حتى نحسب degree of movement of joint. هنا for development anomalies of condyle neck. هنا نشوفها condyle is smaller المؤشر عليها is smaller than normal condyle. هنا يختلف إذا نشوفها. هنا عندنا ال TMJ to detect grossly displacement fracture of condyle. هنا نشوفها.
Hello everyone and welcome. My name is Maan and we're going to talk about the second part of our presentation today, which is the specialized radiography. There are a number of imaging techniques and many diagnostic modalities that have been developed over the past decades which are widely used throughout the world. This specialized radiography gives greater information for diagnosis that are not usually evident on conventional radiograph. Here we have the 6 types of specialized radiography that I'm going to talk about each one in details. First one we have computed tomography or CT. CT is a digital technique providing images of thin slices with variable thickness. As it's shown in this figure, CT is a large machine. The patient is going to be laid down where multiple small projections across the body that combine the information to form an image, sections, or axial slices. We often see CT machines in medical X-ray departments, but today CT is commonly used in imaging of the oral and maxillofacial area. Each axial CT image is about 1.5 mm thick. This axial image can be reconstructed to form coronal sagittal image. So in CT examination we have 3 images that we have 3 plans giving us 3 different images: axial, sagittal, and coronal. With the maxilla usually requires about 20 to 30 axial sections, whereas the mandible requires about 30 to 35 sections. Here we have a video of a CT image in coronal view, showing how it has an excellent differentiation between different types of tissue. In CT, there are basically 3 colors: white, black, and gray. Black is for air, while white is for bone, and the gray is indicated for fluids and soft tissue like brain and eyes. The view here is axial plane moving in upward direction. CT has an advantage over other radiographic technique. It's allowing visualization of high contrast resolution and tissue structure. But however, the examination is expensive and may give very high radiation doses to the patients. And also, a marked artifact may be produced by metallic objects like stainless steel crown and filling. So, with these disadvantages of computed tomography, their uses should be justified based on clinical information. Now we're going to talk about the uses of the CT scan. CT scan used for extensive maxillofacial trauma cases like fractures. Like in the picture here, the CT scan demonstrates comminuted fracture of the right body of the mandible. Here's the right body of the mandible, we can see the fracture, and also fracture of the tooth. The second picture here, we can see a small fracture in the floor of the orbital cavity. We can see also the inferior rectal muscle has herniated into the left atrium. Another use of CT scan is investigation of tumors, cyst, hemorrhage, and bone abnormalities. These three figures show gingival sequamous cell carcinoma in the anterior region of the mandible. In the figure A, CT scan shows bone destruction in the anterior region. In figure B, after adding the contrast medium which enhanced the soft tissue image, that shows the soft tissue part of the tumor. In figure C, a metastatic lymph node, we can see here with a necrosis, is visible in the submandibular gland level on the left side. CT also used for diagnosis and characterize the extent of pathologies of paranasal sinus like rhinitis, sinusitis. Here we have in normal sinus cavities like ethmoidal sinus, maxillary sinus, nasal cavity. If there is any pathologies or infection or any swollen tissue in this cavity will appear as a gray discoloration. Like in this picture here, we have here an active sinus infection in the maxillary sinus. That will be shown as air bubbles or as an air fluid level in this, like shown in this picture. CT also used for neck and head infection, like for detecting the submandibular abscess. Here is the CT shows infection of odontogenic origin on the left side. As we can see the soft tissue swelling on the left side of the mandible, like the infection here is spreading to submandibular space. Also this picture, the coronal CT image here, shows dentogenic abscess, which is a large one on the left side. Here is the abscess here is in the lingual side of the mandible. Here is the mandible and the abscess in the lingual side, and this may extend up to the skull base. And the last one we have for CT uses is that used for aneurysm, arteriovenous malformation, or vascular pathology of CT angiography. What is CT angiography? It's a test that uses X-ray to provide a detailed pictures of blood vessels. CT angiography can show narrowed or blocked or any blocked area of blood vessels or any malformation or abnormalities, like this picture is shown to us. Cone beam CT or CBCT is a variation of traditional computed tomography CT system. It's one of the latest revolutionary cutting-edge technologies in dental and maxillofacial imaging. CBCT utilized a single cone shape of X-ray beam directed toward the patient's head. Instead of a fan-shaped X-ray beam is used in a traditional medical CT. Here the object is placed between the source and the detector's mechanism. Those rotated around the patient's head in about 360 degrees. During scanning, slices of different thickness can be reconstructed in any plane, enabling fast, detailed, undistorted images of a craniofacial structure. in cross-sectional, axial, coronal, sagittal, panoramic, and 3D images. This table shows the comparison between CBCT and CT. In CBCT, the whole area is scanned in one rotation using a cone-shaped beam, while in CT, the images the patients in multiple slices using fan-shaped beam. In CBCT, the poor soft tissue contrast when compared to CT, while in CT has a good contrast resolution and differentiation between different types of tissue. CBCT has a lower radiation doses, or about 10 times lesser than regular CT. CBCT is a compact, reduced size, feasible for use in dental office. It's also cost effective, while CT is a large and expensive equipment. Also, CBCT has a short scan time or high-speed scan, about less than 30 seconds, and CT has a long scan time. Mostly, CBCT is used for dental alveolar examination, while CT is used for examination of a larger area, facial trauma, and tumors. And about artifacts from metallic objects are seen in both CT and CBCT, but in CBCT, it's less severe. This figure is showing how CBCT image is going to be appeared to us. We have here the axial view of the jaw curvature, and we take a cross section perpendicular to the jaw curvature, and it's appeared like this multi cross sectional image. We can move through them, so we can find here the mental foramen. Now we're going to move to the uses of CBCT. The most commonly used is before placement of dental implant. Why? We use this to assist the width of the dental alveolar ridge before the placement, and also to assist and measure the proximity of dental implant to the inferior alveolar nerve. Also, to assess the proximity of dental implant to the maxillary sinus in the upper jaw. The second most commonly used is the assessment of impacted unerupted teeth, cystic and neoplastic lesion. This figure is showing a non-erupted lower third molar, which causes an extensive resorption of the distal root of the adjacent second molar. The benefits of using CBCT is to see the proximity of this impacted tooth to the adjacent anatomical structure like inferior alveolar nerve. This picture also demonstrates the impacted tooth with dentigerous cyst. I would like to show you a real CBCT image of my friend's impacted tooth. Now I've inserted the CD to the laptop and these figures came out. Now these figures are taken in axial view, with the slices have been taken from the top of the head all the way to the bottom of the chin. I'll just click to any one here. Now here on the right I have a scrolling bar. While I'm click on it and moving it, the slices will be moving in a downward direction. Okay, now we are in the upper jaw. Here are the roots of the upper teeth. I'm just looking on screen to find if we find any abnormalities. Okay, now we are in the lower jaw. What we have here, we have an impacted we have an impacted third molar. If if we keep moving downward, what we're going to find? Okay, we have here an impacted second premolar. What we can also do, we can measure the width of the alveolar ridge, can measure the tooth itself. We have here the width is 10.02 millimeter. Now we keep moving downward. And that's it. This radiograph shows a large lesion in the palatal part of the alveolar bone, with a thinning of the lower anterior border of the nasal cavity. Another use for assessment for any trauma in maxillofacial region. Like this figure, we have longitudinal plaque line in the lower jaw, and also a fracture in the tooth. Also this figure, we can see the horizontal root fracture of the upper teeth. We can assess temporomandibular joint TMJ pathology with CBCT, like this figure showing the disc displacement with reduction. Also this figure shows the fracture in the neck of condyle. In these figures, the cross sections of the condylar head. Another use for CBCT is to finding foreign bodies in head and neck region. Like this figure, we have the periapical and radiograph. This indicates for a foreign body which is extruded into the maxillary sinus. And the last use, we have the assessment of airway space in obstructive sleep apnea. Like in this picture, we can, from a CBCT image, can assess the degree of blockage of pharyngeal airway. Magnetic resonance imaging, or MRI. MRI is another imaging method that uses radio waves rather than X-ray. It's utilized in various medical fields, but in dental application it has a little use. It's mostly aimed at imaging soft tissues, TMJ morphology and function. It's based on behaviors of protons, which positively charge nuclear particles in a magnetic field. It's hydrogen protons, which is called a proton density, which is give us or create the MR image. Like this image of normal TMJ, any white color is giving a high signal intensity. An intermediate signal intensity gives a gray color, and a low signal intensity gives a black color. The strength of this magnetism depends on the proton density of the tissue, which depends on the number of hydrogen atoms in the tissue, fluids, and fats. In MRI image, there are many factors that lead to prediction of final MR image. We're going to talk about T1 and T2 weighted image. The differences between T1 and T2. In T1 image, one tissue is bright, is fat, giving a high signal intensity. It's the most anatomical image. It can be used as a reference for anatomical structure or to distinguish between fat and water, which is the bright signals. In T2, two tissues are bright, it's fat and water, giving a high signal intensity. It's generally more pathological and more commonly used. We use T1 and T2 weighted images, but with fat suppressor. To suppress the bright signals from fat and become dark, to enable better view of pathology and in and around anatomical structure, particularly edema and also adrenal tumors or bone marrow pathology. As in this picture, two pictures on the left and the two pictures on the right is demonstrate the MRI image T1 and T2 after using a fat suppressor. T1 and T2 weighted image but with gadolinium contrast. This process involves injecting of contrast intravenously. Gadolinium appears bright in signals, allowing for detection of details abnormalities. Is found to enhance vasculature, arteries, or pathologically vascular tissue, intracranial metastasis, and meningioma. Like this picture, we have a meningioma T1, T2. And in T1 plus contrast, the meningioma is shown more clearly by gadolinium contrast. And you have this image, coronal T1 MRI of normal anatomy of oral cavity. We have here the BU, which is vaccinator muscle, masseter muscle, temporalis muscle, genioglossus muscle, and SLM for superior longitudinal muscle. And also for this picture for assessment of progression of caries lesion and apical lesion. MRI uses for tumor staging, tongue, and the floor of the mouth tumors. Like here we have a carcinoma of the left oral tongue. And we have the polymorphic salivary adenoma, painless, gradually enlarging swelling on the left side, and a tumor in the right retromolar trigon. The second use is the soft tissue swelling. Detect for soft tissue swelling, space infection, masseter hypertrophy, space occupying lesion. Like in this figure, it shows the cyst in left parotid gland. And in this clinical view, showing hypertrophy in the left masseter muscle. Also an MRI image. Another use for TMJ, integrity, disc displacement, and internal dearrangement. Is used in looking for cases of facial pain and also for searching for space occupying lesions or demyelinating diseases in brain, skull base, or infratemporal fossa. Like this picture, we can see demyelination plaques we can see in the brain that's caused by multiple sclerosis. And the last use is for angiography. MR angiography is for vascular lesions and assessing blood flow for free flap planning, like we have talked in CT. Here is the small comparison between MRI and CT. In MRI, give a high detailed image of soft tissue and a less detailed image of bony structure, while in CT has less detailed in soft tissue and more detailed image of bony structure. MRI is much more expensive than CT and uses radio waves rather than ionizing radiation. So an MRI has no side effects, while a little side effect in CT. The duration of the procedure is much longer in MRI than CT, about 30 minutes, while in CT the duration about 5 to 10 minutes. Ultrasound imaging or US. Ultrasound is one of the investigation modalities, non-invasive and widely available diagnostic tool that have been applied in diagnosis of accurate various diseases in maxillofacial region, and especially superficial soft tissue, such as inflammatory swellings and lymph node pathologies. Ultrasound using sound waves. that passes through the tissue of different acoustic impedance. Part of it continues to penetrate and is absorbed by air, bone, and that no image will result. And part of it is reflected back to award the transducers. The reflected echoes are reconverted into electrical energy, amplified, processed, and displayed on the screen. Now let's talk about advantage and disadvantage of ultrasound. The advantage of ultrasound is that it is non-invasive nature, painless, and rapid, that it has no harmful effect on tissue. Sound waves are not ionizing radiation. It's widely available and relatively inexpensive. Gives accurate details of soft tissue without much distortion. While the disadvantage, real-time tomographic image technique is operator dependent, which means that radiologists must be present during the investigation. Limited use in head and neck region, as we said, because it's restricted to the superficial structure, and the sound waves may be absorbed by bone. Can be difficult to interpret by inexperienced operators. Ultrasound imaging uses. Before we start to talk about the uses of ultrasound, we must know that the echoes of sonographic image are termed as hypoechoic, that gives a dark color, hyperechoic, that gives a bright color, and isoechoic image that gives a gray color. Now let's talk about the most uses of ultrasound imaging is in diagnosis and assessing the size, number, position of soft tissue lesion, such as salivary gland pathology, cysts, and the tumors. Okay, we have these pictures on the left. It indicates a normal parotid gland, while this picture on the right shows a pleomorphic adenoma. We can see sharply defined hypoechoic lesion indicates a benign tumor. Another picture shows a normal lymph node of the neck. A healthy lymph node we can see by a hypoechoic part from the center hyperechoic area, while this shows a metastatic lymph node of the neck. You can see the large size, round shape, and necrotic area shows hypoechoic cyst in appearance lesion. Another use is aids in prenatal evaluation of craniofacial anomalies of head and neck region, like a cleft lip and palate. Also used for detection of salivary gland and duct calculi. As in this picture, we have a submental region which shows a small hyperechoic structure, this condition called a sialography. What is a sialography? It's a condition where a calcified mass forms within salivary gland and is usually seen in the duct of submandibular gland. As this picture is showing to us, the calculi present in the duct of submandibular gland. Another use to assess the spreading of infection through the facial spaces and differentiated from cellulitis. Ultrasonographic picture in the cases of cellulitis show ill-defined edge with heterogeneous pattern and hypoechoic intensity. Also, there was an increase in thickness of involved muscle and subcutaneous tissue. While in the cases of abscess, the edge were well defined with homogeneous pattern and hypoechoic intensity with posterior acoustic enhancement. And lastly, it's used for diagnosis fractures in hard tissue. Like this, we have a zygomatic arch fracture. Now, let's talk about sialography. What is sialography? It's a specialized procedure for radiographic demonstration of major salivary glands by introducing radio-opaque contrast medium where into the ductal system. Like this picture showing the normal sialographic view of submandibular gland. Sialographic procedure is divided into 3 phases: preoperative phase, filling phase, and emptying phase. In step 1 involve taking preoperative radiographs. Why? We use it to assess if there are any abnormalities like radio-opaque obstruction, and if there is a shadows of normal anatomical structure that may overlie the gland, such as hyoid bone. In step 2, first thing we're going to use a probe or lacrimal or periodontal probe. Use it to dilate the sphincter at the ductal orifice. Like in this picture, we're using a probe to dilate the head of the submandibular duct. And sometimes we may give the patient a lemon and suck it for 2-3 minutes to open the duct for identification of its orifice and for easier passage of catheter or cannula. The second thing, we're going to insert the catheter or cannula, which is blunt needle connected to a syringe containing a contrast agent that's going to inject the contrast medium into the duct of submandibular gland. And then the radiographs are taken, ideally at least 2 different views at right angle to one another. To come out this radiographic picture show us the submandibular duct, and here are a structure in the submandibular duct. In step 3, emptying phase, the gland is allowed to empty for 5 minutes without stimulation. The allowed this contrast medium is used by giving the patient a lemon juice at this stage to aid exertion of contrast medium. Now we're going to see a number of pictures of sialographic appearance. Like in this figure below is a sialographic view of normal ductal architecture. Any ducts for any glands showing as branched leafless tree appearance. And also this figure showing the normal parotid gland, which is seen as tree in winter appearance. This is a view of a normal submandibular gland, which is shown as a bush in winter appearance, which means a small tree appearance. In Sjogren's syndrome, which is an autoimmune disease, it's shown in sialographic view as a cherry blossom appearance. We can see the wide-spreading dots and blobs of contrast medium throughout the gland. That's because of the weakening of the ducts lead to escape of contrast medium. In sialodocartis, which means dilation of duct system, this dilation is caused by a large calculi or a large calculus at the posterior end of the main duct, as the sold arrows pointing, and associated segmental dilation in the structure of the duct beyond the stone, giving us the appearance of sausage link. In sialolactasis, which is an inflammation of glandular tissue, we can see a focal collection of contrast medium within the gland, giving us the appearance of dots or blobs. In salivary calculus, we can see the radiolucency on the way of the duct. This is a filling defect in the main duct. It indicates for a calculus. We have here a brief talk about the indication and contraindication of sialography. We use sialography to determine the presence or position of calculi or other ductal obstruction. We use the extent of ductal and glandular destruction and extent of glandular breakdown. Contraindication to the patient who has allergy to contrast agent, especially iodine. If there is an acute infection or inflammation because the pus may discharge from the duct opening, and if the radiographs showing calculus which is close to the duct opening, giving us the risk of dislodgement into the gland. The last subject we have for today is arithrography. Arithrography involves injection of radio-opaque contrast material into the joint space, which provides information regarding the soft tissue components, especially the shape and position of the articular disc. So arithrography in dentistry is used to give an diagnostic imaging of temporomandibular joint. I'm going to show you a short video about the procedure of arithrography and how we're going to insert the instrument into the joint space.
Local anesthetic is injected to insufflate or blow up the superior joint space prior to insertion of the irrigation instrument. The patient's jaw should be in an open and protruded position to make room in the superior joint space for the instrument. Once the instrument is in the joint space, the stopcock is turned on towards the patient and the plunger is pushed with moderate pressure. Here we can see irrigating fluid passing through the outflow IV line.
In this picture, we can see this is the space occupied by the disc. Can be visualized lying between the layers of contrast material. So this space in radio opacity is filled with contrast material, and the disc is visualized between them. We may face complications of arthrography procedure. We may have complication of doing arthrography procedure like joint sepsis, allergic reaction to iodinated contrast medium, pain during and after procedure, disc perforation, and the transient facial paralysis. And that's it. I hope you find our presentation and seminar useful to you. We've tried to make the subject much easier to be visualized. So thank you very much and have a nice day.